When looking at the coverings of the brain, the dura mater is going to be the strongest, and it contains two layers of fibrous connective tissue. A periosteal layer, which is attaching to the inner surface of the skull, hence osteal bone, and it's found only in the brain region. The meningeal layer, then, is a true external covering of the brain and extends all the way down to the vertebral canal as spinal dura mater, and typically these regions are fused. There are some areas that they separate, and that's where you see dural venous sinuses, the collection of venous blood from the vein or the brain, and they empty venous blood into the jugular veins of the neck. If we look at the dura mater, it extends upward to form kind of flat partitions that divide our cranial cavity. These partitions we call dural septa, and their goal is to limit excess movement of the brain. And there's three main septa anatomically you would want to know. The falx cerebri, that's a longitudinal fissure. So we can see this falx cerebri here. It's attached to the cristagalli. The falx cerebelli, it's along the vermis of the cerebellum, separating those two lobes of the cerebellum, and the tentorium cerebelli, which is horizontal dural fold, and it's over the cerebellum and in the transverse fissure. The next layer, if we're moving from superficial to deep, is the arachnoid mater. This is the middle layer, and it contains some spiderweb-like extensions. It's separated from the dura mater with a subdural space. We can see here, it's kind of this layer right here, the arachnoid mater. And the subarachnoid space beneath the arachnoid mater is where cerebrospinal fluid is containing, as well as where we have kind of the largest area of vasculature within the brain. There are these tiny little white granulations. We call these arachnoid granulations that protrude through the dura mater, and they move into the superior sagittal sinus. And this allows for reabsorption of cerebrospinal fluid back into venous blood. And lastly, we have the pia mater. The pia mater is connective tissue. It clings tightly to the surface of the brain. It's what's like lying on the surface of the brain itself. It follows down into every convolution, and it contains multiple little tiny blood vessels that help feed the brain, whether it's blood or whether it's nutrients.